So this is the simulation lab. You've heard about it, right? Okay. So all you're seeing here are what? Mannequins. Have you heard of mannequins? Oh? Have you heard of mannequins? So tell us what you know about mannequin.
I think they are like, I'm really the one that I see.
400 level dental students. So
Images of humans that can be practicalized on before getting to see the patients.
okay. Turn by turn. And my house officer, Dr. Precious Oluwafemi. Okay. Of course, you all know me. I'm what? Dr. AKPALABA, consultant ENT surgeon. Thank you very much. For all we have done in the clinic and part of what we have done here as our tutorials, this is a model of the what? Of the what? Okay, you can come around. Just come around. Okay. So this is going to show us all the different parts of what? The ear. You are in the department of ear, nose, and throat. Okay? The ear, the nose, and throat. And universally, it's called ear, nose, and throat, head, and neck. Because we take care of things happening in the ear, in the nose, in the throat, and then the head and neck. Why? Because all of them have what? Connections. They are all interconnected. Not that we like too much work. Okay? They are all interconnected. So that's why a problem or a pathology in one can lead to problem or pathology. Is the outer part of the ear extending up here, okay, or down here to involve the words eardrum. The outermost part of the ear is divided into how many parts? 3 parts, which are? So the outer ear, you have the what? The pinna. The what? External auditory canal, which now is bordered by the what? Eardrum. Demarcating it from the what? Middle ear. Okay? So this is the model showing you that. What's the difference between external auditory meatus and external auditory canal? Who will tell us?
Meatus is the external auditory canal. Good.
The meatus is what? An opening. Because sometimes in some books, some individuals, some authorities, they interchange the word external auditory meatus, external canal. Don't mean the same thing. The meatus is this opening or this window that now opens into the what? The canal. The canal is this tunnel, this channel. This is the canal. This is the what? Meatus, external auditory meatus. Then external auditory what? Canal. Okay? Someone will take us on the anatomy of this. So I'll just introduce this to you so that you know. Then on the day of the seminar, he will tell us more about it. So we have talked about the external part of the ear. Then this is the middle ear. The middle ear is like a cube, a 6-sided box. Okay? So you can see the parts. This is what? The eustachian tube. Okay? It opens into the what? Pharynx, into the nasopharynx. This is the tympanum itself. This cavity itself, the middle ear cavity, is also called the what? Tympanum. This is the eardrum. And attached to it is what? The what? Malleus. You can see the malleus, then the incus, and these what? Steps. You can see the steps that attaches here. Okay? Then After the middle ear, you see the what? Inner ear. Inner ear is made up of vestibules. You have the semicircular canals. You have the what? Vestibulocochlear nerve. Okay? Okay? So what do I say is what is the name of the three small bones in the middle ear? Okay? Show us the eardrum. That's the eardrum. Okay? And these are what? This is what? This is the handle of the malleus. And this is the what? Incus. And the what? Steps. Okay? Then the middle ear extends posteriorly into the mastoid area. Okay? I won't bother you with so much of it. But you have small, come and see. You have some small impressions here, which denotes what? The air cells. You have the mastoid air cells. Okay? In the mastoid bone. Show me your mastoid bone. Where do you find it? At the back of the ear. Okay? Everybody touch your mastoid. Good. So this is the mastoid area, mastoid air cells, which is part of the what? Middle ear. When you come back to ENT, we'll tell you more about that. So I can fix this back. You all will come and look at it. And what is this? The cochlea. Say it aloud now.
Cochlea.
Good. That's the cochlea. So we say vestibulocochlear nerve. Okay? The ear subserves two functions. What are the functions? Hearing and what? Balancing. Good. So through these semicircular canals, the ear helps to what? Maintain balance in the body. While the vestibulocochlear nerve does what? How many nerves are in vestibulocochlear nerve? The vestibular and the cochlear part. The vestibular takes care of the balance part of it, while the cochlear takes care of the what? Hearing. Okay? So it now takes it to the what? Brain for interpretation. Okay? All right, so this is for the ear. Then, in the nose, this is what we have just talked about now. This is still the ear model. Okay, so this is the pinna, as we have talked about, the meatus, and then the canal. Okay, you can see how the impression it makes in the head. All right, so that's about the ear by way of introduction. Then you can see, what is this? What is this? If you look at it, what is it? The shape of the what? The nose. This is an impression for the what? The eye. Okay? So by the time you have a cross section of it, a vertical cross section of it, this is what you have. Okay? So the septum. This is an impression of the septum. It divides the nose into two cavities, which are called what? Nasal cavities. Okay? The nasal cavity. You can see, I say, when you want to talk about anatomy of anything, you talk about the gross anatomy, embryology, histology, blood supply, which encompasses arterial supply, venous drainage, lymphatic drainage. Then you talk about the nerve, the innervation, the nerve supply. Okay? Then you summarize everything and then tell us about the what? Clinical implication of the anatomy. Why you must know the anatomy of any part of the body you are talking about. So you can see it has a very rich supply of what? Nerves, of arteries, and what? Vein. So any little problem around here will cause what? Bleeding. And bleeding in the nose is called what? Epistaxis. Good. Epistaxis. And we had already said that the nose takes care of what? Sense of smell. So problem in the nose can cause loss of sense of smell, which is called what? Anosmia. Anosmia. Okay? So we also told you that during the seminar that the arterial supply in the nose is by what? End arteries. So if there's any problem with this, it causes what? End arteritis. We can cause what? Necrosis. That's why we discourage the use of adrenaline in packing the nose. It will cause end arteritis, which can lead to what? Septal perforation. That will give what? A saddle nose deformity. Okay? So if you look at this now, from what we have talked about, we're not going so much into all we have said before. What is this? What is this? Do you remember the cranial nerves? Who can go through the cranial nerves once more? We have how many cranial nerves? 12, okay? What's number one? Olfactory. Show me the olfactory nerve here.
This is the bulb.
Good. This is the olfactory what? Nerve. These are the bulbs and then the nerves. These are the bulbs and these are the what? Nerves. Okay? So any problem in this nerve system, in this innervation system, we may cause disorder in what? Disorder of smell. Okay? Loss of it. Total loss of it is called what? Anosmia. And I told you to look into the definition of another type of disorder of smell, which you call what? Cacosmia. Okay? So if you have edema or nasal obstruction, air that comes from the exterior will not bring smell to this because there is edema causing obstruction. So these nerves will not be able to take the stimuli to the brain for interpretation. So the person may have loss of what? Smell. That's why most times when you have upper respiratory tract infection or common cold, catarrh, most times you see that, you notice that you can't perceive smell because most of the turbinates are what? Edematous, engorged, preventing proper physiological function of the what? Nose. Okay? So these are the turbinates. These are the turbinates in the what? In the nasal cavity. You have, how many turbinates do we have? 3. So you have the what? Inferior turbinate, middle turbinate, and what? Superior turbinate. And under them, you have what? Meatai. Each one is called what? Meatus. Okay? So this is what? Corresponding to the turbinate. This is inferior turbinate. So what is this called? Inferior meatus. Okay? This is middle turbinate. What's here called? Middle meatus. And this is the superior turbinate. What is here called? Superior meatus. Then when we talked about the paranasal sinuses, we say we have four pairs, okay? And that they are named according to the bone where they are located. So you can see this is the eye. This part is what? The frontal area. And you can see this air space here now. So what will you call this? Frontal sinus. So you have each pair on each side of the what? The face. So this is the right frontal sinus and the left frontal sinus. They are usually demarcated by what? A septum. Okay? Then, at the base of the skull, this is the skull and this is the base. So at the base of this skull now, which one is this? Sphenoidal sinus, okay? Sphenoidal sinus. The maxillary sinus may not be, is not demonstrated here, but it's usually seen at the what? Cheekbone, okay? It's seen at the cheekbone. It's seen at the cheekbone, okay? Do you appreciate that? Good. Which one? Come and show me. Okay, whether it's a sinus. Oh, that looks like the pituitary fossa. Well, it's small, it's not the pituitary. Pituitary fossa should be here. Yeah, it may be an extension of this sinus. It's an extension, but this is the main sinus, okay? Good. So all other ones are impressions for nerves and other structures, okay? So these are the structures you see in what? Each nasal cavity. This is showing you what happens on the what? Septum, okay? So any perforation here will cause what? Septal perforation. Gunshot can cause it, pressure necrosis, trauma, and all other things, okay? So that's about the nose. Then you have this. Though it's not complete, but this is showing you both part of the pharynx and the neck. Here, what is this? The epiglottis. How many parts of the pharynx do we have? 3 parts, which are nasopharynx, oropharynx, and laryngopharynx. Okay, the laryngopharynx is also called what?
Hypopharynx.
The hypopharynx. So this part now is what? The hypopharynx. And this structure here is what? The larynx. Okay? So this is found within the what? Laryngopharynx, also called the what? Hypopharynx. You can see that on the outside, the pharynx is related. The pharynx is made up of different cartilages. The larynx, rather, the larynx that you find in the what? Hypopharynx is made up of what? Different cartilages. You have the paired and the what? Unpaired cartilages. So what are the paired? There are three paired cartilages and 3 unpaired cartilages. So there are what? The cricoid. Can you show me the cricoid here? Is here. Somebody show me, show me, show me. What is this? What is this? That's the cricoid. This is the cricoid cartilage. This here. The blue one, okay? This blue one that is continuous is the what? Cricoid cartilage. Why this is what? The thyroid cartilage, okay? And this is what? The epiglottis. So these are the what? The what?
Paired.
Are you sure they are paired? The unpaired cartilages. The paired ones are very small. You have the arytenoid, the cuneiform, and what? Coniculate, yeah, cartilages. They are not very prominent here. So this is the epiglottis. In between the epiglottis and the base of the tongue is a space we call the what? Vallecula. Okay, most times when you eat food and it misses its pathway, it lodges into the what? Vallecula. The space between the base of the tongue and the what? The epiglottis. That's the vallecula where food lodges, and it gives you what? Choky sensation. Okay? Choky sensation, forming what we call foreign body in the what? in the throat as well. Okay, so within the larynx you can see, let me open it. Okay, so you can see this is now a cross section of the what? Larynx. So you can see this whitish indentation that represents the what? Vocal cord. What's another name for the vocal cord? The glottis. Okay, the glottis. So above it you call it the what? Epiglottis. Anything happening within this area is called the gluteal area. Then under it, below it is what is called the what? Hypoglottis. Okay, the vocal cord is the glottis. The larynx as a whole is also called what? The voice box, because it's from the larynx that you're able to what? Make voice, produce sound. Okay, so that's why it's called the what? Voice box. So any problem in the larynx can cause loss of voice, which we call what? Hoarseness, roughness of voice, which is what? Hoarseness. Don't call it hoarseness of voice. That is what? Tautology. Hoarseness itself means roughness of voice or rough voice. Okay, so you don't need to put voice again. Let's call it hoarseness. Okay, so any problem with this glottis or any pathology within this larynx will cause what? Hoarseness. And it can as well cause what? Difficulty in breathing, because this larynx, the glottis, the vocal cords open and close to help in maintaining what? Respiration, breathing. So if the vocal cord closes, it gives what we call stridor, and the person may not be able to breathe. Okay, so the larynx takes care of what? Breathing and what? Production of sound. Okay, so extending below it is now what? The what? Trachea. You can see the different tracheal rings. What is this? The thyroid gland. Okay, the thyroid gland. So you see the thyroid gland around the what? The larynx and the trachea. Okay, you will know. We'll talk more about that in subsequent lectures. Any question? Any question? All right, so you can look at it, look at them, touch them, study them, ask yourself questions. So I give you 10 minutes to do some identification of parts, okay, with all these models. All right, you're free. So this is the manual showing you all the, for the ear, all the labelings. You can find out their different names. Okay, their corresponding names. So you can look at it. For the ear model, not the nose. Okay, so for ear examination, you use the corresponding hand to hold the what? Otoscope. Corresponding hand to the what? Ear. So this is what? This is the left ear. And I'm using the what? Left hand. So you hold it like a pen. See how I'm holding it? And then let this form a fulcrum. So that you don't push this so much inside to cause what? Trauma. See, as I'm about entering this hand, the back of my fingers is what? Forming a fulcrum on the patient's face as I'm putting it. Okay, so you then drag the ear and look in. This is how to hold the otoscope. If you hold it anyhow, it looks cumbersome and you may cause trauma to the patient. I see some people holding it like this. Is not the right way to hold it. The right way to hold it is like what? A pen. Okay. So, all right. So take your turns. Hold it like what? A pen. Good. 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 Another person. All right. Another person. All right. Okay. So you hold it like a pen. Good. Another pen. All right. Good. Okay, so you people have all done well. So I think you're tired, right? Yes. Good. I know you're tired. I think we can call it a day. Any question? Any question? So on Friday or next week, we take your presentation. Oh, you're rotating to another unit next week. What's your
Anatomy of the pharynx.
anatomy? Okay, so quickly give us in 5 minutes. Will you be able to deliver? Let's listen to him. Let's give him that. So let's assemble. Listen to him fast. You can see a model here that can help you.
So the outline, we'll talk about the definition of the pharynx, the parts of the pharynx, the histology of the pharynx, the musculature of the pharynx, the innervation of the pharynx, the blood supply to the pharynx, and also clinical significance of the pharynx. So to begin with, the pharynx is a crucial anatomical structure present in in the throat region, which serves as a common pathway for both the digestive and respiratory system, crucial in swallowing, in breathing, and also in speech production. So the pharynx is a muscular tube. It measures approximately between 12 to 14 centimeters, extending from the base of the skull to the level of the sixth cervical vertebrae. That is where it extends from the base of the skull to the level of the sixth cervical vertebrae. Then the pharynx can be divided into three parts: the nasopharynx, the oropharynx, and the laryngeal pharynx. And each of them have distinct anatomical features and functions that separate them, that can use to distinguish them. So to begin with, before I go to the parts of the pharynx, I want to talk about the layers of the pharynx. The pharynx consists of 4 layers. We have the tunica mucosa, which lies in the inner cavity and contains epithelia. Then we have the tela submucosa, which consists of blood vessels, lymph vessels, glands, and connective tissue. We also have the tunica muscularis, which consists of the 2 muscular layers of the pharynx, which is the internal, the circular muscles, and the external ones, the longitudinal muscles. We also have the tunica adventitia, which covers the pharynx from the outside. So these are the 4 layers of the pharynx. So then going back, here you can see a picture of the pharynx, the nasopharynx, the oropharynx, and the laryngeal pharynx. This is a picture illustration of the pharynx. So beginning with the nasopharynx. The nasopharynx is the first part of the pharynx, situated posterior to the nasal cavity and superior to the soft palate. It is continuous with the nasal cavity, so you can see from the name where it gets its name from. The nasopharynx is continuous with the nasal cavity. Then the nasopharynx is lined with respiratory epithelium via its connection to the nasal cavity. So it is lined with silated pseudostratified columnar epithelium with goblet cells. The structures that are contained in the nasopharynx include the adenoids, which are known as pharyngeal tonsils. These tonsils, they are enlarged at age 3 to 8, and after that they begin to regress. Then we also have the auditory tubes, like we saw here. The auditory tubes that we saw here, that is the station to it connects to the nasopharynx. Then we also have pharyngeal recesses, which are fossils of Rosenmuller. Is also present in the nasopharynx. Then I want to also talk about the border between the pharynx and the nasal cavity is known as the corner, internal nose. This serves as the border between the nasopharynx and the nasal cavity. Then the function of the nasopharynx is that it has as a conduit for air passage. That means it serves the respiratory function, conditioning air, inspired air, and as well as propagating this air into the lungs. So the nasopharynx serves a respiratory function in the body. Then the adenoids, I mentioned that adenoids are structures present in the pharynx. These adenoids also play a role in immune defense. So those are some functions of the nasopharynx. So after the nasopharynx, we have the oropharynx. The oropharynx is the middle part of the pharynx. It extends from the level of the soft palate to the upper border of the epiglottis. So from the soft palate to the upper border of the epiglottis, this epiglottis that we saw here, that's where the oropharynx is. Then structures present in the oropharynx are the posterior one-third of the tongue. They also have lingual tonsils, pharyngeal, lymphoid tissues are also present there. They also have palatine tonsils. They're also present in the oropharynx. Also, superior constrictor muscle is present in the oropharynx. Then another important structure in the oropharynx is the Wadeyer's ring. The Wadeyer's ring is an important structure present in the oropharynx. The Wadeyer's ring is a ring of tissues. It's a ring of tissues present in the nasal and oropharynx formed by the palatine, lingual, and adenoid tonsils. That is what the Wadeyer's ring is. A ring of tissues present in the nasal and oropharynx consisting of paired palatine, adenoid, and lingual tonsils. Then the function of the oropharynx is that it serves as a common pathway for air and food. So it serves as a common pathway transmitting both air and food. Then, like the adenoid tonsils in the nasopharynx, the palatine muscles present in the oropharynx also play a role in immune defense. And these tonsils can become inflamed, causing tonsillitis, which I will talk about later. So that's the oropharynx. Then we have the laryngopharynx. The laryngopharynx is the most distal part of the pharynx, extending from the upper border of the epiglottis to the lower border of the cricoid cartilage and continues inferiorly with the esophagus. So that's the extent of the laryngopharynx. The laryngopharynx, from its name, it is found posterior to the larynx and communicates with the larynx by the laryngeal outlets. And lateral to the laryngopharynx, you can also find the piriform fossa at the lower border of the cricoid cartilage. So some structures that are present in the laryngopharynx are the piriform recesses, the epiglottis, the arytenoid cartilages, the entrance to the esophagus is also found at the laryngopharynx. So function of the laryngopharynx is that it acts as a passageway for both food and air, and the epiglottis present in the laryngopharynx help to prevent food from entering into the trachea during swallowing. So that is the function of the laryngopharynx. So it acts as a passageway for both food and air. So you can see the posterior view of the pharynx. The nasopharynx communicating with the nasal cavity, the oropharynx with the oral cavity, and the laryngopharynx communicating with the larynx. That is the posterior view of the pharynx. So I also want to talk about the pharynx pharynges. The pharynx pharynges is like the border between the pharynx and the border between the pharynx and the lower parts of the skull and the base of the skull. That's what the pharynx pharynges is. It is a non-muscular, non-collapsing upper end of the nasopharynx where the pharyngeal mucosa is firmly applied to the body of the sphenoid bone and to the pharyngobasilar fascia. So you can feel it as the attachment points between the base of the skull and the pharynx. That's what the pharynx pharynges is. So this is the pharynx pharynges I'm talking about, where the pharynx joins with the base of the skull. So the histology of the pharynx. The different parts of the pharynx are both lined with different types of epithelium. For the oropharynx and the laryngopharynx, the pharynx proper, they are lined by non-keratinizing stratified squamous epithelium, while the nasopharynx is lined mainly by silated pseudostratified columnar epithelium. So that is the different types of epithelium lining the different types of the pharynx. So the musculature of the pharynx. The pharynx is composed of several layers of muscles. They are divided into two groups. The inner, known as the circular muscles, and the outer, known as the longitudinal muscles. So for the circular muscles, there are three circular pharyngeal muscles. They are known as pharyngeal constrictor muscles. So we have the superior pharyngeal constrictor muscles, the middle pharyngeal constrictor muscles, and the inferior pharyngeal constrictor muscles. And these muscles, they are arranged like a stacked glass, which form an incomplete muscular ring circle around the pharynx. That's the way they are arranged, like a stacked glass, one on top of the other, forming a ring, a circle around the pharynx. So these circular muscles, they contract sequentially so as to propel food from the pharyngeal lumen into the epiglottis. Into the esophagus. So they contract so as to propel food from the pharyngeal lumen into the esophagus. So the pterygomandibular ligaments, the alveolar process of the mandible, the medial pterygoid plates, and pterygoid annulus of the sphenoid bone. Those are the originations of the superior one. Then they insert posteriorly into the pharyngeal tubercle of the occipital bone, of the occiput and the pharyngeal raphe. That's the section for the superior pharyngeal muscle. Then the middle pharyngeal muscle is located in the laryngopharynx. It originates on the stylohyoid ligaments and the os of the iron bone and inserts posteriorly to the pharyngeal raphe. Then the inferior pharyngeal constrictor muscle is also located in the laryngopharynx, and it has two components: the thyropharyngeal fibers, which originate from the thyroid cartilage, and the cricopharyngeal fibers which originate from the cricoid cartilage. So that's all about the circular muscles of the pharynx, the circular pharyngeal muscles, which are the inner muscles. So the other group of pharyngeal muscles are known as this is a pictorial illustration of circular muscle. We have the superior constrictor muscle, the middle constrictor muscle, and the inferior constrictor. So you see how they are stacked on top of one another. So next we have the longitudinal group of pharyngeal muscles, which are the stylopharyngeus, the palatopharyngeus, and the saphingopharyngeus. What these do is that they act to shorten as well as widen the pharynx and also elevate the larynx during swallowing. That is the function. So while the circular group of muscles act to propel food into the esophagus, these muscles act to work on the pharynx itself, shortening it and widening it, so and elevating the larynx during swallowing. So those are the different functions of both groups of muscles. So the stylopharyngeus muscles originate from the styloid process of the temporal bone and inserts into the pharyngeal wall. And what differentiates the stylopharyngeus muscles from the other group of muscles is that it is the only pharyngeal muscle innervated by the glossopharyngeal nerve. That's what differentiates it from the other group of muscles. Then we have the palatopharyngeus muscles, which originate from the hard pellets of the oral cavity and insert into the pharyngeal wall. Then after that we have it is innervated by the vagus nerve. Then after that we have the saphingopharyngeus muscles. It originates from the eustachian tube and inserts into the pharyngeal wall, and it's also innervated by the vagus nerve. So while the stylopharyngeus muscle is innervated by the glossopharyngeal nerve, the others are innervated by the vagus nerve. Then in addition to contributing to swallowing, these muscles also open the eustachian tube so as to equalize the pressure in the middle ear. So the kind of act in balancing, opening the eustachian tube to equalize the pressure in the middle ear. That's one of the functions of this. Then we have a pictorial illustration of the longitudinal group. We have the palatopharyngeus, the stylopharyngeus, and the saphingopharyngeus. So innervation of the pharynx. Innervation of the pharynx is complex and it involves the branches of the cranial nerve, which are the glossopharyngeal nerve, the vagus nerve, and the accessory nerve. So this nerve, they control the muscles of the pharynx, they control swallowing, sensory perception, and autonomic functions such as swallowing and reflex. So motor innervation is sensory innervation is achieved by the glossopharyngeal nerve. The pharynx receives sensory innervation from the glossopharyngeal nerve, and also additional sensory innervation from the anterior and superior aspects of the anterior and superior aspects of the nasopharynx also receives sensory innervation from the maxillary nerve, and the inferior aspect of the laryngopharynx is innervated by the internal branch of the vagus nerve. So this is the sensory innervation of the pharynx. Then for the muscle innervation of the pharynx, all the muscles of the pharynx, like I mentioned before, are innervated by the vagus nerve, except the stylopharyngeus muscle, which is innervated by the glossopharyngeal nerve. Then next is the blood supply. So arterial supply to the pharynx is from branches of the external carotid artery, including the ascending pharyngeal, the facial, and the lingual arteries. So these are responsible for blood supply to the pharynx. The venous drainage is achieved by the pharyngeal venous plexus, which ultimately drains into the internal jugular vein. So that's for the blood supply to the pharynx. Then you can see the graph illustration of the vasculation on the pharynx. So you can see the external carotid artery here supplying the pharynx. So, understanding the anatomy of the pharynx, you also have to look about the clinical significance of this structure. One of them is pharyngitis, which is inflammation of the pharynx, either due to bacterial or viral infection. Pharyngitis. We also have tonsillitis, inflammation of the tonsils, which causes sore throat and difficulty in swallowing. We also have pharyngeal cancer. It's another clinical indication of the pharynx. That is malignancy arising from the epithelial lining of the pharynx. And these are usually associated with alcohol consumption, chronic alcohol consumption, smoking, and the human papillomavirus, HPV virus. These are associated with pharyngeal cancer. Then we also have dysphagia, that is difficulty in swallowing, which can result from neurological disorders, structural abnormalities, and muscular dysfunction of the pharynx. Though I did not use an example of tonsillitis. You can see inflammation of the tonsils there. And this is an example of pharyngitis, inflammation of the pharynx. So on the pharynx, you can see how red it is. So what I wanted to speak about, I did not add it. There's also pharyngeal abscess, which is a complication of pharyngitis. That is pus, collection of pus that occurs as a result of a complication of pharyngitis. So this can also cause chronic pain, sore throats in the pharynx. Then we also have trauma to the pharynx. It's also another clinical complication of the pharynx.
Okay, let's give him a round of applause. Okay, so well done, well done, well done. So let's have some questions for him, comments and then answers. Okay? Ask your questions, feel free, ask questions from the beginning till the end. They were quite self-explanatory. Okay, among the Wadeyer's ring, there's supposed to be four groups of it. You skipped one. So you have the tubal tonsils as well. You have the adenoids in the nasopharynx. Okay? Then still the tubal tonsils also in the nasopharynx. Okay? The tubal tonsils are around the eustachian tube. Do you understand? Around the opening of the eustachian tube in the nasopharynx. That's where you get the tubal tonsils. All of them are immunological in function, preventing infection, fighting against infection from the nasopharynx into the middle ear through the eustachian tube. So wherever there are orifices, there are immunological cells to protect against infection around there. So you have the tubal tonsils, the adenoids within the nasopharynx. Then in the oropharynx, you now have the lingual tonsils at the base of the tongue. That's why it's called lingual. Lingual tonsils at the base of the tongue. And the palatine tonsils within the at the sides of the lateral part of the oropharynx. Then, while you were talking about the function of the laryngopharynx, you mentioned that it primarily takes care of breathing and food passage. One would be wondering, calling larynx that you're talking about food passage, how is food entering the larynx and all that? So you needed to tell us that the relationship or the borders of the structure you see in the larynx. I know you talked about in the laryngopharynx. I know you talked about the larynx, but you need to also mention and emphasize the esophagus. I didn't hear it, so I don't know, maybe you said it. So it's the esophagus within the laryngopharynx that is taking care of the swallowing and food passage within the laryngopharynx. Why the larynx takes care of breathing. You need to specify it so that people don't mix it up. One will still be saying, how can food be passing through the larynx? Okay, for easy understanding. That's something you needed to explain better there. Then, let me see this slide. Just take it up a little. Okay, well, I think someone will now talk about the larynx as a whole. Tell us everything about the larynx. Who does not have a topic? Who Who doesn't have a topic here? You don't have a topic? You have. By and large, you have done so well. So let's give him a round of applause. Okay, thank you. So in the presence of no comments and questions, I think we can call it a day. It's been a long one. Thank you, everyone. It was nice doing this with you all. Yeah, so have a great day. Thank you. Bye.